Alright? I want you to move your wrist up like that. Okay? Very good. Grade 3. Then I proceed to grade 4 and grade 5. Actually, very simple, right? If the patient is not capable of doing grade 3, what shall I do? If the patient can move, automatic, it's a grade of 2. Correct? But not able to complete automatic, it's a grade of 2. But how shall I confirm? I'll move the forearm into what? Into a mid position. Then I ask the patient to what? Extend the wrist like this. Alright? Do you understand, class? So, if the patient was able, whether it is incomplete, whether it is complete ROM, but it is in a gravity eliminated position, I would still give it a grade of 2 because it's not a grade of 1. Because a grade of 1 is only palpable or visible contraction, but there is no joint movement. Do you understand, class? So it's very simple. Then do it on the opposite side as well. Alright. Next, so that is C5, C6. Next is C7. Alright. So how will I do C7? What did I tell you? I think I have to demonstrate. I need to have a patient. Alright. Alright. C5. Alright. Can you bend your right elbow fully? Alright. Very good. Alright. Now, bend. Bend. Alright. Moderate resistance. Good. Maximal resistance. Very good. Next. Bend your right elbow. Good. Grade 3. Moderate resistance. Alright. Sorry. My stabilization is wrong. My stabilization should be here. Alright. Move it up. Moderate resistance. Good. Maximal resistance. Alright. Next. Alright. C6. Alright. I want you to move your wrist like this. Can you do it? Alright. Grade 3. Now moderate resistance. Supposedly I should be there. Okay. Moderate resistance. Very good. Now maximal resistance. Very good. Next. Alright. Move your wrist like this. Good. Very good. Now moderate resistance. Alright. Good. Maximal resistance. Alright. Good. I will repeat. Alright. Move your like this. Alright. Good. Next. Moderate resistance. Alright. Next. Maximal resistance. Alright. Good. I should be there. You understand? For biomechanics on my part. Proper biomechanics. But just for the sake of demonstration, I will just remain here. Alright. Next is elbow extension. C7. Alright. Okay, I want you to straighten your elbow up. Very good. Moderate resistance. Very good. Next, maximal resistance. Alright, very good. Now, let's do it on the other side. I want you to straighten your elbow. Grade 3. Good. Alright. Moderate resistance. Good. Maximal resistance. Alright, good. You understand, guys? Alright. How about here for grade 2 for elbow flexion? Okay, I'll put it here. Alright? I'll extend. Alright, I want you to bend your elbow. Alright, that's grade 2. Because patient is not capable of doing it in grade 3. You understand, class? Alright. Next, how about for elbow, for wrist extension? I'll have to put it in mid-prone position. Alright, I want you to move your wrist like this. Alright, can you do it for me? Alright, grade 2. Why? Gravity eliminated position. Correct? Grade 1 and grade 2. Grade 1 and grade 0. Still prone position, but I'm going to palpate for the wrist extensors. Either here or here, near the lateral epicondyle. Why? Because most of my wrist extensors are originating from my lateral epicondyle. Or I can just put it here, near the wrist. You understand? If it's at the wrist, I am palpating for the tendons. If here, alright, near the lateral epicondyle, then it's at least near the muscle belly. Do you understand, guys? That's for grade 0 and grade 1. Alright. Now, how about for elbow extension? Same thing. Alright, from here, alright, I want you for grade, alright. Alright, I want you to straighten your elbow. Cannot complete. So, actually, automatic, this is grade 2. To confirm, and place it like this. Alright, I want you to straighten your elbow. Very good. Alright, grade 2. Okay, be able to complete the ROM in gravity eliminated position. Do you understand? How will I test grade 0 and grade 1? Okay, I can do it as well in this position. Or I can do it in this position. I just need to palpate for the insertion of the triceps near the olecranon process. Correct. Next, C5, C6, C7. Now, T1, C8. Okay? Going to what? Long finger flexors. So, I'm going to stabilize the, the middle phalanx. Alright, I want you to move it like this. Alright, can you do it for me? Alright, full ROM. Good. Next, moderate resistance. Alright, good. Maximal resistance. Further. Good. Alright, so that's how I'm going to do this. Alright, grade 3 to grade 5. How about for grade 2? Automatic, it's not complete. So I can actually place the hand as well in a gravity eliminated position. Okay, I want you to. Alright, can you move it? Alright, that's it. So that is a grade 2 muscle strength. Okay, for the finger flexors, long finger flexors, C8. Alright, C8, middle phalanx. Okay, middle phalanx.
Then you will move the distal one here.
The distal. Okay, but sometimes, you know, if you're going to look at the picture or the video in YouTube, no, sometimes they will just ask you to just wrap your finger like that. So sometimes it's also acceptable, but I just wanted to make it more the formal way. All right. So, or sometimes they will just ask, okay, can you move this one here towards? Okay, like that. So they can also do that. Okay. Next is T1. So where's T1? This is T1. Okay. I will have to place it like this. All right, sir. I want you to move your little finger away. All right, that's it. Grade what? Grade 2. All right, grade 2. No. Grade 3. All right, I'm going to give minimal resistance, moderate resistance. All right, good. Next. Maximal resistance. All right. Next. All right, good. Good. Relax. Alright, so the resistance I'll give at the proximal phalanx of the little finger. Why? Because the abductor digiti minimi is inserted to the base of the proximal phalanx of the little finger. Alright, so therefore I'm going to give the resistance there. You understand, class? So that's what I'm gonna do. How about for grade 2? Alright, for grade 2, actually, I can actually place if it's like this, the problem is it will be in a gravity-assisted motion. You understand? It will be in a gravity-assisted motion. So actually, here, if the patient is not able to complete it, that is still automatic a grade of 2. No need for you to put it in a gravity-eliminated position. Because if I'm going to put it like this, it will be in a gravity-assisted position. But I cannot put the patient like this. Alright? There is no such thing as a test position like this in which the forearm is twisted. Alright? So I'm gonna do it also on the opposite side. So, T1, T2. Next, how about for L2, L3, L4, L5, S1? Okay. L2, L3, L4, L5, S1. Alright, you understand? Alright, so, sir, I want you to bend bring your knee towards your chest. Very good. Back. Okay, now I'm going to give resistance. Moderate resistance. Can you do it for me? Alright, very good. Next, going to give maximal resistance. Up. Alright, very good. That's it. Grade 4, grade 3, grade 4, grade 5. Okay, let's do it down here. Move it up. Very good. Then down. Good. Now, I'm going to give moderate resistance. Up. Up. Alright, good. Next, maximal resistance. Alright, good. So, grade 3, grade 4, grade 5. Understood? How can I make it in a gravity-eliminated position? I am going to externally rotate. Alright. So, can you please move your knee up? Very good. How will I do that? Of course, if the patient, can you move your knee towards your chest? Okay, cannot. It's only up to here. Alright, automatic, if I'm going to grade it, I'll already give it a grade of 2 because it's not 3 and it's not 1. Because remember, MMT is only arbitrary. I can only rank it, But the exact differences between ranks, I don't know. I can only give a grade of 1, 2, 3, 4, 5, 0, 1, 2, 3, 4, 5. That's it. But I cannot determine the differences between 1 and 2, 2 and 3, 3 and 4, 4 and 5. You understand? So, to confirm, externally rotate, then move. Alright, good. Down. Let's do it on the other side. Can you move this one up? Very good. Then a muscle grade of 2. Whether it's complete or incomplete, I'll give it a grade of 2. Alright? Now, L3. Alright? Can you move your, okay, can you please move your, okay, straighten your knee. Alright. Okay. Okay. If there's hamstring tightness, what shall I do? I will just have to lessen the amount of SLR, of hip flexion. Okay? Good. Next. Alright, move it up. Very good. Next. Move it up. Move it up. Alright, very good. Now, I'm going to give moderate resistance. Up, 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 up. Good. Next, relax. Give moderate resistance here. Up. Alright, good. Next. Here, maximal resistance. Alright, good. Next, maximal resistance. Alright, good. You understand? L2, L3, L4. Alright. Sir, I want you to move your foot like this. Okay, can you do it for me? Alright, good. How about this one? Actually, you can use a, what do you call this? There's a towel there. Alright. To reduce the friction, I'll put a towel. Okay, can you move it here? Alright, very good. Down. Alright, can you move your foot up? Alright, grade of 3. How about grade of 4? Stabilize. Alright, apply moderate resistance. Okay, move it up, 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 up. Good. Now, I'm going to give maximal resistance. Up, 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 up. Very good. Grade 5. Next, left. Okay, move it up. Very good. Moderate resistance. Up, 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 up. Very good. Maximal resistance. Alright. Good. Understood? Next. If the patient has a muscle grade of 2, what shall we do? Actually, I can also, again, externally rotate it. Alright. Externally rotate and place it in a neutral position. Now, I want you to move your foot up. Alright, very good. Next. Alright. Move it up. Alright, muscle grade of 2. Gravity eliminated position. But in reality, if the patient was not able, let's say for example like this, it is in a plantar flex position, okay? Can you move it up? Okay, there's only slight movement like this, okay? Slight movement only, then I will give it a grade of 2 already in the clinic. But here, you are being tested. So please make sure that you will be able to show that you test it in a gravity eliminated position. Correct. Okay. Next. Yes.
Remember last Osler? Also got device, dorsiflexion, right? We have to start in a neutral
position.
But then in this case, right, can just start in a plantar flexion, right?
Can. Just like what I told you in your Osler there, it does not really matter whether you start, because sometimes you may start in a plantar flex position. But the question is, were they able to complete the 20 degree of dorsiflexion? Because the 20 degrees is not from a plantar flex position, but a 20 degree from the neutral position. So, even if Aaron will be start in a plantar flex position like this, as long as he was able to complete an ROM of dorsiflexion of 20 degrees beyond neutral, that is still complete. So if the patient started at, let's say for example, in a neutral position and was able to complete 20 degrees, that is still normal. Do you get the point? Okay, even if the patient started in a plantar flex position, but as long as the patient was able to complete dorsiflexion of 20 degrees beyond the neutral, then it's still considered normal. Correct? But let's say, for example, the patient is moving. Okay, I'll show you. From a plantar flex position, Aaron was able to move 20 degrees. Is it a full ROM? No. Why? Because the patient started in a plantar flex position. Correct. The muscle has an enough strength to only bring the foot into a neutral position or slightly near the neutral position, but not necessarily the full dorsiflexion ROM of 20 degrees from neutral position. You understand the point? Alright. So, where shall we now? Grade 2. Grade? No. We're done with grade 2, right? Grade 1. For grade 1, guys, it's the same. Just like this. Okay? Whether it is like this, because the patient will not be moving anyway. Alright. So what shall you do? You palpate for the, what? Tibialis anterior. So where is the tibialis anterior? Come. Where do you find it? It's here. It's not here. Alright? It's not here. It is here. Okay. So, I'm going to palpate it here. Alright? Alright, here. Or here. Okay? Come. Okay? Move it up. Yes, I'll give. Okay? I will resist. Move you move it up. Move it up. Now, see? This one, huh? Yeah. So, but here, you cannot see any muscle that is tensing, right? Alright. So, it has to be here. Alright, or here. Alright, so that's 1 or 0. Next is L5. L5. Alright. Sir, I want you to move your toe like this. Alright, good. Next, I want you to move from this position, move your toe up. Very good. Grade 3. Alright. Moderate resistance, grade 4. Move it up. Alright, very good, very good, very good. Good. Okay, grade 4. Next, move it up. Up, 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 up. Grade 4. Alright? Maximal resistance. I'm going to put it back again in neutral position, then apply resistance. Move it up, 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 up. Good. Relax. Alright, next, move it up. Up, 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 up. Maximal resistance. Guys, look at this. I'll give resistance. Up. Okay, you can see already the tendon. So this is the same tendon that you're going to palpate later for grade 1 and 0. Alright, so it will be in a neutral position. Alright, I want you to, okay, move. Like that. So if it's moving like that, I can feel that the tendon is moving up. Okay, so a small movement like this, alright, is a visible contraction, palpable contraction if I can feel that the tendon is tightening. Alright. Understood, guys? That is for grade 1, 0. And then how about for grade 2? Again, I can put it in a externally rotated position and I can ask the patient to move your toe up. Alright, like that. Okay, move your toe up. Very good. So that will be a grade of 2. Now, plantar flexion. Guys, plantar flexion, alright, can be done like this or I can also put it like this. A little bit like this. Okay. And then I'm going to start the foot like this. Going to put it in a neutral position. So I can do it like this, or I can do it like this. I'll put the foot in a neutral position. Okay, I'll ask the patient, okay, point your foot down. Alright, grade 3. Alright, next. Alright, I'll put it in a neutral position. Grade 3. Alright, that's it. So patient will be able to move. Alright? So I will have to assist. Here, I'm just assisting it towards what? Towards neutral position. But then when I ask the patient to point the foot down, I'm going to release it. Alright? Why do I need to hold it a little bit like this? Because if I am going to allow the patient, or I'm not going to support it, there is a tendency that the gravity is the one which is moving the foot in a plantar flex position and not the active contraction. Okay, look at this. Okay, just relax. Alright? Alright. Just relax. Now, what happened to the foot? It is already plantar flexing due to the effect of what? Gravity. Correct. But if I will hold it like this, alright, just relax. Relax your foot. Alright. Then, I want you to plantar flex. I can see whether it is plantar flexing because of contraction or because of gravity. Do you understand, class? Because I cannot put the patient in. Why can you not change the patient's position? Come on. Correct. The spinal cord is injured and most likely patient is immobilized. Right? Patient will be on a what? A plastic body jacket, or let's say for example in a what do you call this? An orthosis. So, or the patient can be in a traction machine. So you'll not be able to move the patient. You cannot change the position. You cannot put the patient in sideline. You cannot put the patient in prone position. You understand, class? So that is the reason why you have to do this.
So from here,
Correct. So here, all right, like this, all right, and then relax, just relax, all right, and then move it down, all right. So I would know easily that it is what? Move it down, point it down, all right. I would know that the movement is due to muscle contraction and not because of gravity. Because if I put it like this and then I'm not supporting it, then it is already placed in a plantar flex position. I wouldn't know whether there is muscle contraction or it is only moving towards plantar flexion because of gravity. Alright, like this.
So
Yes.
what if we put it in a gravity eliminated position instead?
Gravity eliminated position for grade 2.
For grade 3, for plantar flexion grade 3.
this right?
Because we cannot go, cannot go prone.
So,
Other pathway is
for gravity eliminated position, plantar flex.
Is it possible? Because for the little finger also we're doing like
Yeah.
gravity eliminated.
I am not sure. I'm not sure. Because this one is really for grade 2 only. If I put it like this, then it will be for grade 2. Because it's already in horizontal position. So when I do the movement in a horizontal position like this, it will be more on gravity eliminated position.
But T1 also we do it in
Why? Because it's a small muscle. They were saying that small muscles are not much affected by gravity and buoyancy. If you can still remember. Alright? Small muscles are not much affected by gravity and buoyancy.
So this one's supposed to be this one's supposed to be harder than this one, right?
This one?
This position, if I plantar flex in this position, is supposed to be harder than this one, right? Because this one is gravity helping me. This one is I have to do all by myself.
Okay.
That's what I thought.
But I am not sure about that. Because we are not, I haven't seen any assessment on what do you call this? Even on the internet that is done like this for grade 3. Okay? So usually for me, okay, it's just tested like this. Again, most of the exercises or the testing is done here in supine. We'll just have to modify it a bit for grade 2. But in terms of whether we can do it on this type, I am not sure about that because it is not written in the book. And I haven't seen it as well in the ISMS CI. Alright? So I am not sure about that.
So it's this grade 3 and this grade 2.
Okay.
Okay.
Alright. Alright. So for grade 1 and grade 0, it's the same. Okay? I'm going to place the patient like this. I'm going to support the ankle like this. And I will have to palpate for so for grade 1 and 2, same thing. I will have to move it like this, support it, and then palpate for what? Either I palpate the belly, but most of the time we can palpate for the tendon of Achilles. Okay, I'll palpate for the tendon of Achilles. And then, alright, I will have to, move your foot down. Okay, I can palpate whether there is contraction of the muscle or if there is tightening of the Achilles tendon. Alright, so like this. Alright, so don't contract it too much. Okay, so that's it. Okay, don't move it. Alright? So, there. I can see if it is tightening. For grade 1 or grade 0. Now, when you go on to the clinic class, actually it's very simple.